palpitations is the general term we give to any unusual and persistent awareness of your heartbeat. So people describe it in various ways. Skipped beats, missing heartbeats, a flutter in their heart rhythm are typical descriptions. And there are a number of causes of palpitations, but broadly speaking, um, the main categories in my current practice include a significant proportion of people who will have palpitations and in whom I carry out investigations, uh, but I don't find anything serious in terms of I'm able to confirm that I have normal cardiac structure and function, and we carry out rhythm monitoring. And what we tend to find is what we call ectopic beats, ventricular and supraventricular ectopic beats. And sometimes patients can be quite aware of these ectopic beats, which we generally reassure are never going to cause them any serious harm. But we then look at lifestyle factors which may be having an impact on these type of symptoms, and most of the time that is effective, and in a small proportion of patients do they actually need treatment for these ectopic beats. The second category is an important rhythm diagnosis called atrial fibrillation. That's very important to screen the population for this arrhythmia, which is gets commoner as you get older, is associated with high blood pressure or hypertension, and can run in families. That condition is important to screen for and diagnose in certain types of patients because it has important treatment options. For example, many patients will need to be advised for blood thinning to stop them from having blood clots. But even atrial fibrillation, which is the commonest arrhythmia that we diagnose in association with palpitations, is not usually a serious or life-threatening condition, but it does need important treatment. And finally, the other group of patients, relatively less common, are people who've already got heart problems, structural heart problems. They've already had heart admissions with heart-related problems, and they often will already have some degree of structural problems with their heart. In those patients, there are another set of rhythm disturbances which potentially can be more serious, and require specific treatment. Yeah, there's a general rule for that. I mean, it's always better to be safe than sorry. So general advice is that if you have any persistent, it doesn't have to be palpitations, for example, chest discomfort or breathing difficulties. To some extent, so you know your body the best, and if these symptoms are severe and persistent, the safest thing to do is always to seek medical attention. And if this is in the middle of the night and there's severe symptoms, then that will have to be the casualty department. If the symptoms are not so disabling, then you can try and make an appointment to see your general practitioner. Um, but the safest thing to do is anything severe or persistent and causing you to feel unwell, like causing you to feel dizzy or very breathless, you should seek immediate medical attention. Yes, so I alluded to the three commonest groups in the first question, but sometimes you can experience palpitations in association with other medical problems. Now, one of the questions is, do thyroid dysfunction cause palpitations? Now, whilst the books will tell you that thyroid dysfunction, and in particular an overactive thyroid, can cause palpitations, I can tell you in real life practice, that's actually relatively uncommon. But you can get palpitations in association with any severe medical illness. So if you're admitted to hospital, or you have a very bad infection, or if you're having other problems with your with other parts of the body, if you're severely unwell, you can experience palpitations as part of that, and in a small proportion of people, we may also discover an arrhythmia. Thyroid dysfunction, is linked with palpitations, but I think in my actual experience, it's relatively uncommon. It's interesting how when people present with palpitations, we often advise as part of the workup that we should check their thyroid. But in fact, if you look at how many times those results come back abnormal, it is relatively rare, but it's always screened for. But in people who've already got established thyroid problems, then in general, if they're experiencing symptoms of palpitations, then what we want to strive for is what's known as the euthyroid status. In other words, we want to make sure that their thyroid function is stable. And the way we do that is we gauge it with a blood test, which assesses the status of the thyroid. And sometimes, if you've got an overactive thyroid in association with palpitations, then a specialist might advise, well, first of all, appropriate investigation of why you've got an overactive thyroid, but certain treatment may then be suggested. An underactive thyroid is quite unlikely to be associated or cause palpitation. So it's really the overactive thyroid state. Home remedies, or I think you mean drugs that you can get from health promotion shops and chemists. My general take on this is that there wouldn't be a specific home remedy that I would routinely advise or prescribe for my patients. I normally promote a certain health promotion that I would advise for most of my patients, not just those presenting with palpitations, would include that they should partake in regular exercise to promote cardiovascular fitness. They should follow a healthy diet, which has a broad spectrum of vitamins and minerals and fiber. And obviously they should refrain from excessive alcohol consumption, and obviously not to smoke cigarettes. That would be my general home-based advice, what we call lifestyle modification measures as required. But there wouldn't be a particular home-based remedy that I would recommend, or that I feel has clear what we call evidence base for routine use.